I love this state, and one of the things I love about it is everywhere I go, people thank me for my service. And you talk to any veteran, it's this kind of awkward situation where you don't know exactly what to say. If I know someone's a public school teacher, I thank them for their service. But I think one of the things that bothers us the most, right, is it's just a trite thing to say. You say, thanks for your service, and then people move on about their lives. And I think this is a moment where that is more true of our elected representation in Congress, particularly our two senators and the majority of our House members, where it's so easy for them to say thanks for your service. It's so easy for them to wear a flag pin on their lapel. And they go around giving speeches, as the president did throughout the campaign, about how military service and veterans have nothing to fear. And then they come out with a bill like the House reported out a few months ago, and the majority leader served up yesterday. And as Terry said, of the 20 million veterans in the United States, we have about 8 million of them actually use the VA for their health services. A large percent of those are actually just for kind of specialty care, unique needs, often related to combat. But 1.8 million veterans in the United States are on Medicaid. And a far larger number of them are relying on Medicaid for their children, for their spouses, and for their parents and their siblings. And that's especially true for our younger veterans who are just getting out, just getting established professionally, just trying to build careers in whatever they're going to be doing after their military service. The Center for American Progress took a look at the Senate's bill yesterday and ran some numbers. And they predict by 2026, 441,300 veterans will lose Medicaid, along with their families. And the highest state of any of the 50 states is, I think probably won't surprise you, Texas. They expect 76,000 Texas veterans to lose that Medicaid coverage that they're relying on, and more importantly, that their families are relying on. And while, yeah, there are some of us that served overseas, we're eligible for VA benefits. Some of us that have been lucky enough to make transition well and get good paying jobs will have benefits. But the most important things I learned as a young officer is that if my soldiers don't have medical care, I don't get it. If they don't eat, I don't get to eat. If I don't get to use the phone until they use the phone, because that's community. That's how you build a family of warriors, and that's how you build a strong army, and I think that's how you build a strong nation. And so, I want to thank all of you for being out here, for reminding us that we have a duty to stand up for each other, because if there's anything that I took out of being a soldier, it's just we stand up for each other. And when you stand up together, you're all stronger. So thanks again for your time, and I appreciate your support.